Yeah, majority of gallbladder disease that we have or related to gallbladder is because of gallbladder stones. Gallbladder is a storage area for bile, and when we eat, the gallbladder contracts to sort of allow more bile to be flowing into our intestine. Bile is kind of like a soapy substance. It helps us absorb basically fat to allow it to cross the cell membrane into our own system, body system. So bring it from inside the gut into our actual blood system. When for some number of different reasons, stones can form. Usually start from small crystals all the way to golf ball sized stones as big as those over the years. And since the gallbladder is the blind-ended tube, you can imagine these little stones can end up plugging the little exits, tiny little what we call duct, just little connecting tubes to the intestine. When they get blocked and the gallbladder is trying to contract, it's trying to pass a stone, or it's like having a baby in some sense, except this contraction force or the pressure behind it is what causes the pain. Typically people will be several hours after a meal, sometimes a very fatty meal, not always. They'll have severe pain, usually right around the upper gastrum, almost sometimes pretend like a heart attack. They can be similar in that sense. Lower chest, epigastric, upper abdomen, and often associated with severe nausea and vomiting. I can remember my mother had these when I was young. She will be 11 o'clock, 10 o'clock at night. She will be bending over, throwing up, in severe pain, kneeling right next to her bed. And then after a couple hours, all of a sudden it all got better and it goes away. That's a typical gallbladder attack. Now the patient sometimes will come in early and they get better. And then because what happens is the pressure eventually relaxes, then the pain goes away, the symptom goes away. But if it doesn't release itself, or for some reason they get infected, then the pain persists, and these will last beyond the typical 3 or 4 hours. There will be 12 hours, 24 hours. That's when it becomes a surgical emergency before it turns gangrenous or become really infected, or sometimes rarely it bursts. That's where surgery, urgent surgery, emergency surgery is needed. Most of the typical gallbladder attack are seen by primary care physician initially, diagnosed and referred to a general surgeon, electively taken out. The ones we see is the one that the pain has not gone away. There's a concern that this thing is going to burst or turn gangrenous. That's when we get involved and take out the gallbladder.